The cause of my PTSD was my work at the hospital. The military tries to train you well to do a job. What the military doesn't do is train you at all about how to deal with the emotional consequences of doing your job. In 1967, I was trained as a field medic to administer immediate first aid on the battlefield. Instead, I was assigned to a hospital in Japan, and basically none of my training applied. To the outsider, an assignment in Japan seemed like a fantastic job in an exotic country. The reality meant wounded soldiers directly evacuated from Vietnam, oftentimes months of working 12-hour shifts, multiple daily dressing changes of severe wounds with extensive tissue loss, and dealing with the depression patients experienced as a result of their debilitating injuries. Single, double, and triple amputations, paralysis, and immediate death. I worked on thousands of the most severely wounded patients for 3 years. During a typical 8 to 12-hour shift, I would never stop, constantly moving from one patient to another. This meant no time for developing a relationship with anyone on the staff. Most of the other corpsmen had been drafted and were single. Generally, they weren't that dedicated to their work. Instead, they were more interested in getting drunk and getting laid during their free time. The nurses were officers, and fraternization was frowned upon. I had paid to bring my new bride of 3 months to Japan, and when I first talked to her about my work with war injuries, her comment was, "Don't ever talk to me about that work again." What that meant was that I had no one to talk with, to debrief, to vent about my experiences. Interestingly, the nurses were medically trained professionals, but they didn't do patient care, primarily medications, IV solutions, injections, the receiving and discharging of patients. The greater percentage of patient care was delegated to the ones with only 10 weeks of training, the corpsmen. Erica, a physical therapist and a member of our retreat group, helped me put into words the feelings I've had for so many years. And she explained to me, "Michael, military medical personnel with repeated exposure without pause, treating dozens, hundreds, or in my situation, thousands of severely injured patients, in a short period, this can create cumulative psychological exposures. The medical culture in combat settings necessarily emphasizes composure and focus on the mission, and emotional reactions must be pushed aside in order to keep functioning, to accommodate the mission, which means we medical personnel can develop the equivalent of the 1,000-yard stare that is often experienced by the veteran that has been in combat. These reactions do not disappear. They can resurface later as intrusive memories, hypervigilance, sleep disturbance, emotional numbing, and suicidal thoughts. And these symptoms have reappeared in my life numerous times. As I look backwards, reliving the past 55 years, here are some of my observations about this short story. All military branches know about the emotional effects the mission can have on the soldier, and they choose to withdraw their responsibility. Instead, they discharge this responsibility to the veteran, which can lead to unfulfilled lives, suicide, or hopefully counseling, and sometimes the slow slog of filing for a disability. Observation number 2. I faulted my ex-wife for years, not allowing me to talk with her about my experiences. I have since learned that was not her responsibility, nor did she, as a 21-year-old, have the experience or knowledge about how to listen to such trauma. This failure of each of us not understanding and supporting one another's role ultimately led to the divorce after 13 years. Observation number 3. My current wife of 42 years, my soulmate, will never be able to understand or comprehend the hidden emotions I have as a result of my PTSD. However, separate from my ex-wife, my current wife understands and supports my PTSD idiosyncrasies, why I avoid crowds, why I avoid stressful situations, why I live in the middle of 5.5 acres of land, why I chose to live in so many different countries, and the list continues. Observation number 4. I now believe professionally guided dialogue during my time in the military could have alleviated many of the PTSD symptoms that I've had to deal with for 55 years. Could there have been opportunity for such dialogue? We were at war. Who knows?